Lastly, what about mode of delivery? Should we tell all of our IBD patients, which is what they actually said in the past, you should all have a C-section? Do we need to do that now? And the answer is no. So we've actually, in general, what we do recommend is that this should be evaluated on a case-by-case for each patient based on their disease, severity of disease, location of disease, their disease, is it fistulizing disease, penetrating disease, etc. So it should be case-by-case. Generally, vaginal delivery is not contraindicated for our pregnant patients with inflammatory bowel disease. There are certain exceptions, patients with active disease, and particularly active disease and perianal active disease or fistulizing disease in the perianal, perirectal, rectovaginal fistulas. These patients, we should consider a C-section in those, as well as there's been some discussion for what about those who have a J-pouch or ileoanal anastomosis, and although not necessarily, we don't say if you have a J-pouch, you have to have a C-section. There may be some times when we might want to consider a C-section, and again, important to emphasize case-by-case discussions. The important thing here with mode of delivery is we certainly need larger studies and longer-term follow-up to evaluate these patients because this is such a smaller profile, particularly for the J-pouch cohort. With that said, we just recently started a steering committee for this study with Dr. Marla Dubinsky being the primary PI, where we are evaluating longer-term data, and our site is one of them, where we will evaluate longer-term data for the impact of J-pouch and mode of delivery. In general, there's no difference on the impact of disease by either vaginal or delivery or C-section, meaning that will the disease worsen if they go and have a C-section or a vaginal delivery? No. No impact on disease has been found. In one study, 2,000 women, no difference in IBD-related surgeries, no need for hospitalizations after they either had vaginal delivery or C-section, and no change in therapy was required after they either had a vaginal delivery or C-section. Women with IPAA may have increased nocturnal symptoms, and particularly incontinence is the main factor that we tell our patients, but this was not impacted by mode of delivery. Okay, so again, when we say if you have a J-pouch, you have to have a C-section because you'll become incontinent afterwards, that may not necessarily be the case. It may just be more their disease, their anatomy, but not necessarily impacted by vaginal delivery per se.